Hi everyone. Doc mentioned here Anguka Nayo. I'm not sure whether we are still at Anguka Nayo in Kenya, because the trends are really going so fast. You have to keep up every day. So as mentioned, my name is Brian. I work for Tiko as a mental health officer, program officer. And I'm going to just take you briefly on a cross analysis of our Tiko platform, looking at our integration services data and how that has led to issues of demand creation for services through integration of mental health, and also providing choices for young people in the platform. So briefly about Tiko, my colleague in the morning, Dr. Hilda, talked about Tiko, so I'm not going to really venture into that much. But I'm just going to mention that if you didn't get anything in the morning, remember Tiko is all about providing choices for young people. So when you talk about choices, Tiko does this through integration of services, and it ensures that there's more for the young person to pick from, and there's more for the young person to work with when they are going to access the services. And from the previous speakers, it's clear that there's need for us to have an integrated services within our programs. And we can only do this by ensuring that the services we're providing for the young people are the right services that they do. And the biggest power that we have as Tiko is using real-time data, and through use of that technology, we really acquired so much from young people through co-designing, and also ensuring that we put young people at the center of our design. And through that, we're going to see how integration has really made Tiko's service provision the top notch of what we're doing at the organization. So I'll start first by asking us a very simple question. Who's an adolescent? We keep talking about adolescents, and we're programming for the young people as a program. Who's an adolescent? What are their needs? What are their wants? What do they think about? What are their pains? What are their gains? We keep talking about the adolescents. Now, I would like you to imagine, take just 2 minutes or a second of your time. For those who are young at heart, not for the young people. Well, you're an adolescent. Do you think the services that you're providing currently, or the programs you're having currently, would have served you right by then? Now hold that thought. Then imagine what made you an adolescent by then, so that we can see how these programs are really working, and will they still be functional for the coming future of adolescence. Okay. So within this presentation, the aim is to really look at the assessment of the data we have in integrated services, and see if this is really relevant to the young people we are working with within our platform, and also just to show how relevant it is in terms of health-seeking behaviors that young people have in other products that we have, or other services we have, SRHR and HIV. And this also really portrays how health-seeking behaviors are in Africa and the general population. So going straight is, the whole point of this is looking at how mental health integration is important, and we did this through our cross-analysis. So I'll first start looking by the gap. The gap that exists is we have a lot of issues geared towards adolescents that I mentioned. If you look at the issue of adolescence, it's looking at both emotional, psychological, physical, and also at some point looking at spiritual. And what does this accumulate to? So there are a lot of issues in terms of chronic diseases or poverty that coupled up with what you do. And just merging all these, there's need for other services that are needed. So for mental health, we already know that mental health is one of the leading causes of death among young people through suicide. And from the most recent data from UNGA is that 1 in 7 adolescents are currently suffering from mental health condition. And it's even worse for depression, anxiety, and other suicidal ideation cases that are coming up over time. And the gap that we've identified over time is, in as much as from the previous speakers, we've seen that mental health cuts across all the programs. Not just as a standalone on NCD, but within the NCD program itself as a delivery, there's need for mental health addressing. So we picked that from it, depression and anxiety are one of the leading causes of mental health conditions in Africa, especially among sub-Saharan African teens, 15 to 24. And with this, there's been a gap in access to service. And this gap exists mostly because of issues of stigma, there's lack of those services, lack of service provision, and information or knowledge about mental health issues, and also issues of community integration of mental health. Community still doesn't know about mental health. And in terms of service delivery, integration is still a challenge. We are looking at issues of integrating other services within HIV and SRHR, but this has also been dragging over time, and we've seen there's a very huge gap in terms of delivering these packages and providing choices for young people in terms of providing integrated services. So how is Tiko serving the young population, or rather adolescents and young people through integration? So currently we have a program called the IPTG. For those of us who are familiar with the IPTG, there's a colleague poster outside, you can learn more about it. So IPTG is a WHO model looking at depression, treating depression at community level, and it uses available community structures. Tiko has embraced this model to provide early diagnosis of adolescents at community level. So we are working with CHPs. Someone asked why we are not working with young CHPs. Yes, there's need for us to work with CHPs because they're the ones who know the community. They know where the issue is. They know where the young people are and who are supposed to be worked with, or rather who need this help. But for our model as Tiko, we also utilize buddy systems. We pair CHPs with our CBOs, which are mostly led with by young people. So with this, when they're in the community doing mobilization, it's easier for them to relate by working with the other young person who they're working with through the buddy system that we have, so that we also get resources, like we utilize the resources that these CHPs have in terms of community reach and accessibility. So this model, the IPTG model, has helped us do early diagnosis in the community. So we work with CHPs by training them for 1 week, and they go out, do mobilization and sensitization in the community, working with the chiefs, the local community administration, and they use the mental health tools. The IPTG, that's the patient health questionnaire, PHQ2 and PHQ9 to do assessments, and that's how we do our early diagnosis in the community. And for choice, we provide choice by ensuring that these young people are taken through a 6 weeks model of the IPTG session, which looks at issues of grief and loss, among others, in terms of addressing issues of quarrels and disagreements in the family. So once the young person has completed these sessions, they're able to access other services within the community through other health facilities that are within the ecosystem of Tiko. And we do this through providing that choice while doing mobilization. And mental health is done at the community level, and the other services are at the facility level. So we are not having them up to one point, but also making sure that these are community models that can be replicated at any point. And out of that, the young person has a variety of choices to pick from. And as I mentioned, if you can pick anything from my colleague's discussion of Tiko, is Tiko provides choices for young people. So what did we find out of this? I know I'm out of time. What we find out of this is that from the service uptake assessment, we realized that through the IPTG model, which was provided in Kenya, in Mombasa and Kilifi, 19,205 young people are able to be screened for depression using the PHQ2 and the PHQ9. These are the mental health assessment tools. And out of the 19,205, 844 were able to access other services, which is HIV, PrEP, and family planning alongside those services. And 62.1 of them were taking up mental health alongside HIV services. And this shows that there's demand for these services. There's demand for young people accessing mental health services, and there's demand for young people getting other services along the HIV service that we're also providing. And out of these 62, we had 36 of them taking up HIV, PrEP, being adolescents 19 to 21 years. So what can we get out of this? I think the major thing is that mental health cannot be treated as a standalone. From the assessment we took from our integration data within our platform is that there's need for strengthen structures or systems in the community to address mental health. And this can be done at the lowest level of the community. We don't need to have these provided because issues of referral and linkage is also an issue. So how can we provide those services within the facility, within the community that these young people are? And we understand that this is the Tiko model. Tiko looks at the ecosystem where the young person exists. So how do we provide those services there? So IPTG has proven to be one of the models that has provided mental health treatment. And from it, we've had a recovery rate of 56 since January for the sessions that we've had. At least 60% of the young people have seen a huge recovery rate of from almost 20 score of the PHQ9 to a score of 9 of the PHQ9 for those who understand the scales. The other key takeaway that we're looking at is mental health seeking behavior among young people has still been low. And the only way is providing this integrated service. So we've seen that there's demand for these services. So providing these services is working by young people and co-designing these services at the community to ensure that they are for the young people and for the young people are able to access them any point. And through this model, we've seen an increase in uptake over the time since 2002 to this point. Thank you very much.